was around 2007, perhaps around that time, that we first began to think about engaging with health issues. And this started with mental health. Second thing we looked at was blindness and geriatric care. These three were of very significant personal meaning to us. But pandemic is not the only thing. I think there are much more difficulty issues that mankind has to deal with. For example, the non-communicable disease burden that is just staring at us. We need to do something about it.
For a long time, I had only common knowledge about public health. I thought it is prevention, protection, and promotion. So prevention and protection are from diseases, and promotion of good health and lifestyle changes and whatever is required. Basically empowering all the people to be aware of what might happen. But I never thought very seriously about it, never went deep into it till COVID happens. I think COVID was a wake-up call for everyone, including me. So that was the time when Subroto and me, we used to discuss what can we do to make people aware about public health. Once we knew that we want to do something in public health, we spoke to many people, spoke to many institutions. When we spoke to Ahmedabad University, we were really impressed with their vision, and they had thought about it in depth, and that was what drew us to Ahmedabad University.
Ahmedabad University is committed to bringing complex problems surrounding our society in its classrooms and addressing them through its research. This aligns with our purpose, which is to foster continuous progress of self and society. Our focus on impact through excellence is where our aspirations and those of Ms. Susmita Bagchi and Mr. Subroto Bagchi come together. Mrs. and Mr. Bagchi have been long-time supporters of improving public health in India and have made significant contributions over the past few years. In their mission to transform public health, they have donated a significant corpus to Ahmedabad University. It is this unwavering support and meeting of minds that has led us to design a new school which is dedicated to transforming public health in India. We have named it in their honor.
When we seek any institutional engagement, primarily Susmita and I look at four things. First and foremost, we look at shared vision. Second, we look at competence, the sheer ability to execute. The third thing we look at is the ability to scale, because if you don't scale, you cannot scale, then you don't stay relevant. The last thing, but not the least, is governance. We found all these four things as tick, 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 tick when it comes to Ahmedabad University, and the mind was clear that this is the institution that can build an institution. Ahmedabad University has a startup feel to it.
We reached out to many people, many institutions, had many interactions with different institutions till we came to Ahmedabad University, and after meeting the people there, after having many interactions, we were very impressed with the vision that they had. They had a plan in mind. So that was what impressed us much. So we thought that we must work together, we must do something that will make a difference. The first thing is that we decided that we will fund a chair and then take it from there. So when we met Professor Josipura, we were so impressed with her plans, with her vision. Our expectation from the school is that it should be relevant for the next 100 years. Different communities should get involved, and it should have an impact at grassroots levels.
Most education and research programs in India have traditionally been conducted by medical schools or standalone institutions, which limits the scope of interdisciplinary collaborations. The Bagchi School will develop a comprehensive program spanning the core public health disciplines. These include epidemiology, biostatistics and data science, environmental health, policy, nutrition, social sciences, and other aspects. We will also build bridges, integrate and collaborate with several other disciplines. Our goal is to improve human and planetary health locally, nationally, and globally. We plan to achieve this by training leaders, by discovering risk factors and preventive factors for major diseases through research, and by translating such findings into evidence-based, sustainable interventions, policies, and programs. We are starting our academic program with a PhD in epidemiology. I'm confident that many of the next generation of leaders will come from our school. I'm both humbled and honored to be the first Dean of the Bagchi School of Public Health.
Mrs. and Mr. Bagchi's contribution supports our interdisciplinary perspective around problem solving at the university and is a big step towards attracting the best minds of the world to our new School of Public Health. We are grateful for their long-term support and belief in our approach that will integrate health promotion, research, and education by addressing real-world challenges.